Well, first of all, welcome to another episode of Candid Conversations. I'm Dr. Funke Afolabi-Brown, and I have a phenomenal dentist here today. We're going to be talking about airway health. You guys know that I am just so passionate about airway health and how it impacts sleep. And so I bring to you incredible experts from pretty much all over the world. This person happens to be in like literally my neighbor. So I'm super excited to have Dr. Sem here. We're going to be talking about what you need to know about your airway, your teeth, your mouth. It's not just for eating. It's not just for the smiles, right? It's not just for talking. There's so much that goes on within that airway system. And so when we're working with dentists, we're learning so much. And, this I feel like is it's an emerged field that's really just blown up over the last few years. So Dr. Sem, the founder of Rituals Dental Wellness, welcome to Candid Conversations. It's so good to have you.
Thank you so much. It's a pleasure to be here for sure.
Awesome. Can you introduce yourself to our friends?
Yeah, so I'm Ekta. I am opening my own dental office, and it is a dental wellness office, and it will integrate more holistic and systemic integrative care into your dentistry. It's a place where we'll analyze your lifestyle, your habits, how does that impact your overall health, because we are very cognitive of the fact that your mouth is connected to the rest of your body, and we want to be very careful about how we treat that and very comprehensive.
Awesome. Tell me a little bit about your story. Like, how did you come to this space of really dental health and lifestyle? Like, I think it's an interesting mix, but I mean, when we had a conversation in the past, I was like, wow, it makes so much sense. But tell us a bit about how you got into this space.
Yeah, how I got into it is, in dentistry in general, I was always interested in medicine, and how our body works. And my grandmother passed away from a dental abscess, and it made me realize that, wow, what goes on in our mouth really can affect our longevity, our life. And this is a very serious thing that we can, help preserve our patients' wellness and their lives. So that I take very seriously. And so to understand that what happens in our teeth and in our mouth affects the rest of our body, I wanted to take that and run with it and really try to understand what are the diagnostic tools that we have that we can use to better help our patients live their best lives. And I found airway health to be such a vast category, so many different professionals that have so many different tools and ways of helping you. And if we can get everybody talking and on the same page, and so that we can get our patients to live their best lives, to address, whatever sleep issues they may have and how are they going to get to their optimal health, I think that we can all work together.
Amen to that, for sure. So why is this such a big deal? I know you mentioned, and I'm so sorry to hear, I mean, a dental abscess, you would think, oh, just something, but why is airway health so important, and why are people now really paying attention?
Yeah, airway health is so important, and it's such a sleeping dog. I mean, it's such a sleeping disease that people don't, there's things like snoring, and it becomes this more sort of a marital issue. We're going to sleep in different rooms, and really it's a red flag that your body's not getting enough oxygen. And so, in our dental chair, we see people with worn teeth, or we see crowding, or we see high vaulted palates, and there's all of these kind of things that we can see in your mouth. And I think that people are now realizing that obstructive sleep apnea has become an epidemic, really, the most underdiagnosed epidemic there is. And so to better kind of screen for those things, especially from a young age, would be the most preventative and the most helpful. But really to get our adult patients on a better track is integral to their livelihood, really.
Yeah. So how do you, I mean, from a dental perspective, because I'm seeing quite a lot of players now, and I am confused. So I can't even imagine what patients feel like. Like, who in the world are we supposed to see? How do we start? Who's kind of like first line? Who's taking ownership? And maybe for you as a dentist, how do you screen for sleep disordered breathing or apnea and things like that in your patients?
Yeah, so with our intake forms, it's going to be pretty comprehensive to understand what your lifestyle is. How do you sleep? Do you have atrial fibrillation? Do you have any of the red flags? You snore. Do you have any other red flags that would already put you in a category of should you be getting a sleep test? And then there are the more silent symptoms, like maybe you have a long neck, maybe you have enlarged tongue, maybe you have scalloping on your tongue, maybe you have worn teeth. Maybe you have enlarged tonsils and I can't see down your throat. So there's a lot of things that we can see in your mouth, and we get to see you at least twice a year. We're very lucky. We get to see our patients very often. And so we become this kind of first line that we, as dentists, have this sort of responsibility to take a look and see what's going on in their mouth. And it really does, if I see a patient's breaking teeth over and over and over again, and we have no explanation for it, there's more than a night guard. There's other symptoms, there's other root causes that are happening that we should be addressing. If you've had braces over and over and over again, your teeth just keep crowding, you've had braces 2 times, or, you've got scalloping on your tongue. That means your tongue is enlarged and it's kind of accommodating for your teeth. And so your tongue has kind of this scallop nature to it. It means that your tongue is very big. That means you're probably breathing through your mouth. So there's a lot of things that we can pick up in the dental chair that would immediately signal, hey, I think you might need a sleep test. And so it would be something that I would do to refer to somebody like you, to help them get a diagnosis. And it could be their family physician. Sometimes I've noticed if I'm talking to a patient about it, they have spoken to their family doctor about their sleep issues, or they've spoken to their ENT about, deviated septum, but they've never gotten a sleep study before. So I think it's in all of our hands to kind of do that, to refer them to somebody like you, so that we can all be talking about how do we get this one patient. We should all be integrating together and working as a team, really.
And I think that's so powerful, because when we think about how important, like you mentioned, your airway health is directly tied to your longevity and your quality of life and everything else. But when you think about it, there are multiple stops and multiple opportunities with the patient interactions. But sometimes for some people, it's not as clear what they should be looking out for. But like you said, dentists have this vantage position where you're in that airway. Like, the primary care doctors are, doing everything, right? From top to bottom. Like,
they're looking at a lot.
Exactly. You're looking at blood pressure. You're looking at a rash. You're talking immunization. There's just so much. But as dentists, and that's why I have so many dental friends and colleagues, and I have everybody's, and now I have your phone number. So brace yourself, have you on speed dial, right? Because you're seeing these patients, literally first line, you're in there, even from when they're young, right? When they're in the dental chair and they can hardly sit still and they're squiggly and ADHD-like symptoms, and you're seeing all the teeth grinding.
Right.
Or the big tonsils. These are things that, right away, those red flags start to come up. And while people might say, well, I mean, you're a dentist, why are you asking about atrial fibrillation? Well, it turns out it is so important, right? So this is just such important work. And I just love the fact that you're now dedicating, your practice to really exploring the whole body, right?
Sure.
Really looking at the airway as the route, right? It's almost like the lens into what's going on in the body. I think that is so powerful.
Yeah, I mean, it explains so much. When you don't breathe well through your nose, you're breathing through your mouth to compensate. And if you're breathing through your mouth to compensate, you're destroying your oral microbiome. And how that results is you're going to have a lot of cavities that are unexplained. And you're going to tell me something like, oh, I don't even eat that much sugar, or I brush and I floss and I keep getting cavities. And, I have a lot of parents say that about their kids. We stay away from sugar. I'm brushing and flossing, I just don't know what to do. Or they're having, like you said, ADHD type symptoms, and it's resulting in anxiety. And, there's a lot of behavioral issues that come from this, because if you don't get a good night's sleep, if your, oxygen levels are dropping multiple nights, an hour throughout the night, that's a real issue that results in, real adult issues, real systemic issues,
Absolutely. So tell us a bit, because I thought that's an interesting correlation. I've actually had a few dental friends tell me that, like unexplained cavities, right? Where you have
Right.
a child who is otherwise has pretty pristine dental hygiene, doing
Yeah.
everything, and they're here with like five cavities. Like, what in the world?
Yeah.
Um, and so why is that? I know you mentioned the changes in the microbiome. Can you walk us through what that is, how that comes to be? Because I,
Yeah.
I don't think a lot of people are aware of that.
For sure. I mean, your cavity fighting properties, they're in your saliva.
Mm,
Saliva holds that's your oral microbiome. It holds all of the,
mm,
good bacteria and the bad bacteria. And
mm,
the good bacteria, they fight cavities for you. And
mm,
if they're drying out because your mouth is open and you're breathing in and out of your mouth, it's drying out your mouth. You're
mm,
basically depleting your mouth of that good
mm,
bacteria, that good cavity fighting bacteria. And so that results in decay in your
yeah,
mouth because your mouth is not able to neutralize, it's not able to fight the bacteria, and it results in unexplained rampant decay in your mouth.
yeah. So I think that two questions I have for you, because earlier on you had mentioned the mouth guard, and this is another question I get a lot of people when I
Mhm.
talk to them, when I have a patient who has sleep apnea, and maybe we talk about options for sleep apnea treatment. It might
Mhm.
be CPAP, it might be an oral appliance, it might be palatal expansion or whatever. And
Right.
usually when I say oral appliance, they're like, oh yeah, my dentist gave me, or somebody gave me, or I got from Amazon, I got a mouth guard. And I'm like, no, no,
Yeah.
no, 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 no.
Right.
Let's stop there
Yeah.
because like you
Yeah.
said, sometimes I almost feel as if the mouth guard actually sometimes make the apnea worse.
Oh,
So
it's
can you
sure.
just can you clarify some of that for folks that are listening in terms of an oral appliance versus a mouth guard, when you should use what?
Right. So I guess when we go into a mouth guard, we would have to really rule out an or obstructive
Mm,
sleep, dysfunction. So we'd have to really rule that out first.
yeah,
If we decide, okay, we don't have any sleep disturbances, there are no sleep obstructions, there are no airway obstructions, then I guess we could move
yeah,
into a night guard, and that would be a plausible thing to do.
okay,
Without ruling out some sort of obstructive sleep disorder, we can't just jump into a night guard because, like you said, that does make
okay,
it absolutely worse.
yeah,
And so we do have oral solutions to this systemic issue. So, of
mm,
course, the CPAP is, if it's tolerable, that's a
yeah,
great solution. And a lot of people can't tolerate a CPAP, or maybe they're
mm,
traveling, or maybe there's a reason why they want to try something else. So we have
yeah,
regular advancement devices, which do, by the way, they do protect your teeth. They do sort of act like a night guard because they do keep your
mm,
teeth intact.
yeah,
But what we're doing a lot of times in a lot of medicine is we're masking symptoms, and we're not
mm,
getting to the root cause of where is this coming from? Why are you breaking your
yeah,
teeth? Why do we need to get you into a night guard? And breaking teeth and wear on teeth is one of the cardinal signs of obstructive sleep apnea. So
mm,
really getting to the cause rather than being cosmetic about it and fixing them up with crowns and making your teeth
mm.
beautiful, which I love. I love beautiful teeth. I'm a dentist. Beautiful teeth make me very happy. But
Yeah,
putting a mask on a broken tooth is putting a crown on it or making veneers out of it. This is just masking an issue, just like putting the night guard or even Botox in your TMJ. These are all
mhm.
masking your symptoms, and they're not treating your root cause. They're not treating the disease.
Mm, And that is so helpful. Now, the other thing you mentioned was, the microbiome and um, saliva and things, and the saliva test and things like that. Can you walk us through what that looks like? What's the role of the saliva test? What exactly are you looking for?
Yeah, and the saliva test, it's very useful diagnostic tool. We can understand what pathogens are present in your oral microbiome and if they're in disbalance. So it would be like if you have excess decay or a lot of um, periodontal disease or gum disease or inflammation that we see in your mouth, we can kind of track the levels of those pathogens in your mouth.
Mm,
And it can even predict things like, if you're going to have dementia in 20 years, or there's a lot of
right.
markers that we have in our saliva. And our saliva is connected to our gut microbiome, which is connected to our skin microbiome. We are all, we're connected human beings. So what happens in our mouth happens in our gut. So, it shows up as, systemic issues, but really there's a lot of things that we can find out from our mouth. And the cool part is, patients can also track their own progress. So if we take a saliva test and then we address it with however we decide to address it, whether it's probiotics or even potentially antibiotics, or if there's some sort of disbalance, we can try to get them nutritionally back on board or something like that. And then they can track their progress. In a year, we could do another one and see. And people like to see how what they're doing is affecting their bodies and how it's affecting their oral environment.
And in terms of that, the saliva test, is it like a swab? Do they spit in a cup? Do they send it for culture? Like, what does that look like?
Yeah, it's like spitting in a test tube. It's pretty easy. Yeah. You just have to flip the line and then we send it out, and it takes about a week to get the results back.
Okay.
And we would want to do that for somebody who has, for example, a lot of inflammation in their mouth or a lot of periodontal disease, like I said, or somebody who has excess decay. And I advocate it for anybody to just understand what their oral microbiome is made of anyway, even if they don't have those diseases going on. I think it's a great diagnostic tool.
Okay. So for you, especially with your practice opening up and all of that, how do you integrate this airway health into whole body wellness? Like, what does that look like? Say, for instance, someone comes to see you, right? They're not, like you said, they're not just coming to see you to get a white smile or even teeth. They're coming to see you for more because you have so much more to offer. So what does that look like?
Yeah, so you come in, before you even come in, you'll have taken a survey of what your lifestyle is, how you approach dentistry, how does your body sleep at night, how are you functioning? So basically an overall lifestyle picture of what you do, and you'll get your own analysis back. It's generated by AI, so you'll get your analysis back about things. It's kind of preparing you about what I may talk to you about nutrition habits and how that may lead to X, Y, or Z in your body, or how that affects your sleep or whatever. And then when you come in, that's when I'll do the exam of your mouth and your head and your neck, and we'll check everything out from your palate to can we see your tonsils to oral cancer screenings. And so we check kind of everything and give you a real comprehensive look at what's going on. We'll even take pictures of your teeth and we'll do a scan of your teeth so that you can see everything on camera in front of you. What do my teeth look like? So, I mean, it's pretty cool because I like to use all of these new AI tools that we have. So with me, you'll also get the computer generating its own advice for you as well. So you get an instant second opinion. So when I tell you, oh, this crown is, failing or something, I don't just tell you, I show you. So I'm going to be taking a video of that while showing you on the screen. I'm a visual person. I like to assume other people want to see. Some people may prefer not to, but it's a very easy way to teach somebody about what's going on. And so there's that kind of solace with, okay, I understand what's happening here, and how do we get to the next phase of making this a better situation?
Awesome. That's amazing. These are, and in terms of your information and things like that, where can people find you?
Oh, so our website is up. It's ritualsdentalwellness.com. It's scrolling across the screen right there. You can put your email in there, and then you'll be the first to know about when we're accepting appointments. And I think appointments should start booking in October is when we'll probably start booking appointments, and we're looking at end of November for opening.
That's really exciting. That is so
Yeah.
exciting. How did you come up with rituals? Why rituals dental wellness? What's the story behind that?
Yeah, I just feel like my main goal is to get people to buy into their oral health, and to really take care of their teeth very mindfully. So, when you brush your teeth, I want you to feel all the sides of your tooth that you're cleaning. I want you to really take it very slowly, very mindfully, just like we do our skincare routine. We're putting it all over our face. We're putting a different cream under our eyes sometimes, and a serum and a moisturizer. And in skincare, we have this ritual of this, then this, then this, and this, and you really feel like you're taking care of yourself. And so I wanted to kind of equate that with dentistry, and with oral health, and to really have this ritual of things that you do for your own, for your mouth to be healthy. And I wanted to be this approachable and very serene activity, because I don't want people to be intimidated by what goes on in their mouth. It is the gateway to your entire body. It is the first thing that other people see when you smile. If you have a confident, beautiful, radiant smile, it makes other people very, trustworthy of you, and you feel better about yourself too. So I really want to bring that mindfulness into how we take care of our mouth. And so creating a beautiful ritual, and everybody's ritual is going to be different. All of us have different needs. And so really thinking of this as an oral care ritual is important to me.
Amazing. I think that's beautiful. Well, it was amazing talking to you and learning about just this important work you're doing, and also helping us to see the connection between airway health and whole body wellness. And I think one of the things I'm taking away is your saliva, that oral microbiome, and the results you get, the kind of evaluation you can get from a saliva test can be life-changing, because it sounds like it really does expose or help you explore a lot of things that might be going on in your body. And also, I love that you are, partnering and collaborating with other members of this team, right? Because it's all teamwork. And I think the more we start to have these conversations around dentists working with sleep doctors, working with ENT doctors, and the primary care physicians, we can absolutely start to make a dent in this epidemic of sleep apnea.
Yeah, for sure. I'm excited to continue working with you and to, integrate you into my practice and see how we can continue to work together and teach our patients. That's what it's about.
Absolutely. Thank you so much. So you guys heard Dr. Sem. Definitely head over on Instagram, Rituals Dental Wellness, as well as the website, ritualsdentalwellness.com. And really, really excited about your practice opening. I think it's going to be phenomenal. And I believe you're in Pennsylvania. Where in Pennsylvania is your practice?
Bluebell. So in Bluebell, Pennsylvania. Awesome. Right off.
You see, I told you guys we're neighbors.
Yeah.
All righty.
Come stop by soon.
Absolutely, you have to. Actually, we have an event coming up. I'll tell you offline.
Okay. Sounds great.
All right, everyone. Listen, if you're out there and you are trying to figure this thing out, you're having either you are struggling with sleep or your child is struggling with sleep. This is what we do at the Restful Sleep Please. We make sleep easy. We make it such that you can get your sleep confidence back. You can be assured of going to bed knowing that you will rest well, wake up refreshed, so that you can be the best version of yourself. And so come check us out. You can visit our website, therestfulsleeplease.com, or come see us in Horsham. We're in 200 Lakeside Drive, or you could give us a call, 215-607-8297. Until next time, I hope you rest well.